Hey guys, welcome back to Graham DVM. Going to spend some time today talking about elbow dysplasia. As you may already know, elbow dysplasia is a pretty common disease that we see in larger breed, younger dogs, and it's involving a complex of disease processes affecting that elbow joint. So let's take a minute to look at the elbow and figure out where this is all happening. So while this image isn't exactly the anatomy picture I wanted to use to show you the elbow, it does demonstrate why the elbow is so complicated. If you imagine this image here is reflecting my elbow bent somewhat at a 90 degree, the reason the elbow is so complicated is instead of just two bones coming together, we have three. We have the upper arm bone or humerus, we have the ulna, which is one of these two fused bones, and then we have the radius. All three of these come together to form this complicated joint in the dog. So if you've gotten this far, chances are pretty good you've already been into your vet and been given the diagnosis of probable elbow dysplasia. The reason I'm saying probable is this can be a very hard disease to diagnose. Sometimes x-rays are sufficient to diagnose it. Sometimes we do have to go off for the CT or the scoping of the elbow to fully appreciate the abnormalities that would describe this as elbow dysplasia. But again, the classic is you've probably been in and been seen for a limp of the front leg. Remember, these are front leg problems. So let's talk a bit more about the specific diseases that we're dealing with elbow dysplasia. So the first condition I want to discuss is called fractured medial coronoid process. Pretty big term, pretty simple problem. What this is literally a shearing off of a little stylet or a little process associated with the ulna. That can happen due to the way it ossifies during cartilage and bone development in this young dog's development, or it can happen if there's incongruity between the radius and ulna, causing an overload of weight on that little process because that ulna is carrying all that weight and then shearing off the edge of that bone. I'll show you what this looks like in a picture. Here's a picture depicting this ulna basically detached from its associated radius and without a humerus coming down. And you can see this little tiny process, the medial coronoid process is seen right here. Okay, this process is usually the source of the shearing. This is the piece that's lost into the joint and sometimes causes the chronic pain and limping. So when that little piece of bone shears off of the ulna in a really young dog, an x-ray might not really show it. Seeing that piece of anatomy on a standard x-ray is extremely difficult. There are summation or overlapping of structures that can make you think you're seeing a broken medial coronoid process when in fact you're not. And on a young dog for whom this process has just happened recently, you're not going to have arthritis to support that's even happened. In a 12-month-old dog or the older dogs, where they've had lots of time for that little fractured piece to cause discomfort and pain and inflammation, you may see those arthritic changes to support that there is in fact a broken medial coronoid process. So if our x-ray didn't really show that we had a broken medial coronoid process, how are we going to see it? Well, in this stage we have to get a little bit more advanced. One option is a CT scan, just more sensitive for the minute details of that elbow. The other option, which gives us the ability to treat at the same time as diagnose, is to actually do an arthroscopy, where we get a scope, we enter the joint of the elbow, we can not only see that fractured coronoid process in many cases, but retrieve it at the same time and solve that pet's problem. If your vet has suspected that there's been a fracture of the coronoid process and your dog is much older and perhaps the option of doing a CT scan or arthroscopy is not in the cards for you, many times the management's going to entail the same management you'd employ for a dog with arthritis. Anti-inflammatories, rest, joint support, all of those are common things that we'll use for dogs with arthritis, regardless of the underlying cause. So another disease process that we see causing this broad umbrella disease of elbow dysplasia is called Osteochondrosis dessicans, or OCD. In this disease, what you're seeing is an abnormality in the ossification process or formation of cartilage on a cartilage surface. In this case, even though we can see this disease in other joints of the body, we're talking about the elbow. This tends to occur on the inside surface of the humerus, so the upper arm bone, and that will cause direct pressure and pain in the joint when a dog is trying to walk. Now, if this cartilage disease process causes a flap, and that flap ossifies and breaks off, it becomes free to float about in the joint. and cause damage and discomfort and inflammation throughout the entire joint. Now, once again, much like when we're investigating for a fragmented medial coronoid process, a CT scan may be helpful. X-rays in this case may also be helpful to see this defect. Or of course, going in with a scope or arthroscopy will allow us to not only retrieve that flap, but evaluate the cartilage surfaces to ensure things are otherwise healthy and normal. So the last component or last dimension of elbow dysplasia I want to talk about is called Ununited Aconeal Process. That's the little nose of bone that comes off of the ulna and fits nicely into the upper arm bone or humerus to allow normal extension and flexion of that elbow and kind of help to cup that end portion of the humerus. So Ununited Aconeal Process, to build on osteochondrosis, used to be thought to be related to that process, where you don't have totally normal end portion of bone development, and so you end up with a separation of this little beak of bone on the ulna. Other things that are thought to precipitate it and can certainly complicate its development include congruency problems in that elbow. If more stress is on that little beak of bone, that too could cause that to shear off. Combined with that, there are other theories that come into it, and truthfully, it's very hard to say exactly what causes this piece of bone not to fuse. Now, because many dogs don't see fusion of this bone to the rest of the ulna until 4 to 5 months of age, formally diagnosing it in an undisplaced scenario, so where if all you're seeing is a little line of lucency, can be difficult to establish. If it's clearly displaced or separated from its normal location, it's safe to say it's not going to heal normally or fuse normally, in which case you could make that diagnosis. So again, in an undisplaced case, if you're less than 4 or 5 months of age, seeing a change in that location might not mean you're going to end up with that particular disease process. It could mean, however, if they're limping, one of those other processes we talked about is in play. So those would still need to be looked at. How we treat a dog with Ununited Aconeal Process depends on their age. In a young dog without any arthritis or very little other joint pathology to be detected, surgically removing that little beak of cartilage might be the way your vet would go. In an old dog who has maybe limped on and off for many years and developed all sorts of secondary arthritic change in their joint, at that point removing this little beak of cartilage may not have the same benefit as a dog whom we catch before these changes occur. It may still be recommended to remove it, but in some cases medically managing the symptoms of their arthritic elbow may be the route they go. So this will be a discussion to have with your vet or with a specialist who deals specifically with some surgery and arthroscopic techniques to determine the best way to go. So make sure you spend some time looking at all the options before you jump into anything surgical or medical in a condition like that. So as you can see, elbows, terribly complicated, lots of bones involved, lots of considerations, and many times multiple considerations to make as we plan a treatment for a dog, a young dog or old dog, limping on their front leg, specifically related to elbow dysplasia, and the many complexes that make up this complicated joint. So guys, if you have questions about this, if there's anything else I can clarify, comment sections are open below. Feel free to post up those questions. I'll do my best to answer them. Until next time, we'll see you here on Graham DVM.